which was held on 4th June. Okay, just wait for a few minutes so that I can get information that everything is okay. Yes. So I can see here. I'm looking for the audio video, all the things. Yes, so here I can see Piyush, Aditya, Gary, Singh, all okay. Okay, fine. So we are going to start our FMG 2020-22 held on the 4th June. We are going to discuss our recent questions which had been asked. Also, we are going to do the analysis and we will see the expected topics which are going to be asked in our December. Yes, myself, Dr. Shrikant Verma, we are going to learn at this beautiful platform NLC. So right now we are looking for the anatomy step by step. First, do you remember at time of our classes I told you sure short question from the general anatomy and one topic joint, and this time the 3 questions from the joint has been asked. And I told you one more thing, that if the joint topic is not asked, yes, even if you are skipping the anatomy joint topic, you cannot move single step in orthopedics. And many questions had been asked on the basis of the orthopedics anatomy portion. So let's start our journey. You will enjoy this one with beautiful concept, tricks, mnemonics, and different kind of the funny stories also. Okay, so here we are going to talk about our first question. I told you during the class, yes, that joint topic will be definitely asked. Can you see the first question? Identify the type of the joint represented by the marked structure. So this question had been asked. So can you tell me the answer? Yes. So tell me what is your answer. I'm looking at the chat box. The option A is synchondrosis, option B is symphysis, option C is syndesmosis, and option D is gomphosis. What is your answer? So yes, fine, very good. So we are going to look for this. See here, this is our radius and ulna. You will observe this is the upper end of the radius, so this is radio-ulnar joint. Yes, it is upside, so this is our superior radio-ulnar joint. Are you getting the point? And in the similar way, here you can see the inferior radio-ulnar joint. Agree everyone? This is the inferior radio-ulnar joint. So this will be your middle radio-ulnar joint. Okay, so there are the 3 radio-ulnar joint. Yes, try to catch these all the points from our 3-dimensional anatomy. See here, yes, we had seen our 3-dimensional model. This is our forearm, where this is the preaxial bone radius, this is our postaxial bone ulna. You can see this is our interosseous membrane, okay. Yes, here you can see the superior radio ulnar joint, and here you can see the inferior radio ulnar joint. Try to understand Can you see this inferior radioulnar joint? Yes, ulna is having one ligament attached with the radius, so ulna can rotate here, and in the similar way at the superior radioulnar joint, see here there is one annular ligament, very beautiful. There is one annular ligament within which the head of the radius is encircled. So what is happening? Try to understand. Within this our ligament, the head of the radius is rotating, and here the our head of the ulna is rotating, and whenever there is the rotation, rotatory movement, yes, here is a synovial fluid filled cavity. This is example of the pivot variety. Okay, just like the C1 C2. So remember, these our superior radioulnar joint, this is our pivot joint MCQ, and inferior radioulnar joint, this is also pivot joint. But you can see the middle radioulnar joint, these are attached with one ligament. This is our interosseous membrane. Such kind of the joint are known as syndesmosis. Getting the point? So this was the recent question. The correct answer is syndesmosis. Fine. Yes, we are looking for our other option. See here, how can we guess this all the things one by one? Okay, another one question, same explanation. Can you see? This is our inferior radioulnar joint, and here is a superior radioulnar joint. The question was, identify the type of the joint represented by the marked structure. Okay, yes, this all the questions are on the basis of the recall by the students. We discussed with them and we framed the question. Yes, there may be the few plus minus, few words may be differ, few option may be differ. So if any clue from your side, you can put here. Yes, the images may be not the same, exact image is not maybe the same, but this will give the clear cut concept. So as we discussed, this is our, yes, inferior radioulnar joint. Yes, this is our inferior radioulnar joint, and I told you this inferior radioulnar joint is pivot joint. Everybody getting the point? Okay, so yes, Akash is correct here. Dancing Medicos is here. Yes, Preeti is also here. Right now we are running the class. Yes, I think Preeti is same student. Yes, Punita Kumar. Yes, you are always associated with us. Dikshit is here. Yes, Hyderabadi student. Dikshit is also here. Yes, we will do. Yes, aag lagadi, aag lagadi, aag lagadi. Okay, so hope you all are getting the point. See here, another question on the joint. I told you definitely the joint question will be asked, and 3 questions over this joint. See here, which type of the joint is involved in tone movement in image. So let's start the discussion. Can you tell me this is upward facing of the palm known as the supination, and downward facing of the palm, that is the pronation. At time of the lecture I told you, yes, when we are eating the food, so when we are putting the food in mouth, this is the supination. When we are holding the foot, that is upper pronation. खाना खाते समय हम बार बार supination और pronation का movement करते हैं. Otherwise, yes, भिखारी जो है वो supinate करता है और king जो है pronate करता है. There is the one statement that beggars supinate and kings pronate. We discussed this all the special movement during our class. So the question from the upper limb part, joint related topic. Yes, the supination and pronation movement occurs where? Remember, it never occurs at the our wrist joint, it never occurs at the elbow joint, but it occurs at, remember, our superior, yes, superior and inferior radioulnar joint. This is your answer. And the superior and inferior radioulnar joints, these are classical example of, yes, pivot joint. Just right now we had discussed. Remember one classical question. This is not a new question. Very old question pattern, that C1 C2. This is the previously asked question. C1 C2. The atlantoaxial joint is the classical example of the pivot joint. Okay, getting the point, everybody? So these are the our different kind of the question. Three questions again. See here, the first question syndesmosis, the another question on the pivot joint, okay, inferior radio ulnar joint was marked, and then supination pronation movement was there. Yes, if any plus minus is there, you can inform us at our chat box. Now try to understand, sir, these all are the new question pattern. No, at time of the lecture I told you the question December FMG 2021, go for the our rapid revision booklet, 30 pages anatomy textbook. Yes, 30 pages our anatomy. We had seen there was the our anatomy rapid revision. We did this class, okay. So only at the 30 pages we describe this all the things, the general anatomy part, normal rule, the Hilton law, and then first topic what I taught you, that was the joint. FMG 2021 put this rapid revision 30 pages booklet in front of you. You will get, I told you, the most important topic according to the current time. The question from the joint was asked in the FMG 2020 and then 2021, and in this year 2022 there was a 3 questions over the joint. So get ready for the December FMG exams. Joint topic will be definitely asked. And again I want to tell you, if suppose it is not going to be asked directly, in orthopedics and in surgery, you cannot move single step without the knowledge of the joint. Agree everyone? This all are the our notes. We had seen all the classification of the joint. It is the fibrous, cartilaginous and synovial joint. Yes, what are the difference between the synchondrosis and symphysis? We had seen. You can go for this our booklet workbook, page number 3. Getting the point, everybody? Now try to understand our next thing. Yes, we had seen this all the classification. We had seen this structural classification. Yes, joints are fibrous joint, cartilaginous joint and the synovial joint. I told you the fibrous joint mnemonic was the Sasuji, sutures, syndesmosis and the gomphosis. Now you are having the clear cut knowledge that this syndesmosis is present. This syndesmosis joint is present at middle radio ulnar joint. Okay. Also at time of class I told you this is also present at inferior tibiofibular joint. And remember, this was the question of the INICET pattern. Okay. So all are same. Whatever the question which is asked in the INICET, they are returned to the our NEET PG, and the questions from the NEET PG they are asked in our FMG exams, and all are coming from the theory part first MBBS. Yes, previously the question from the secondary cartilaginous joint, this was asked. I told you the mnemonic SIM, S for symphysis pubis, I for intervertebral disc and M for manubriosternal joint. And then here is a synovial joint. Always this different joints are asked. Right now the pivot joint was asked. C1 C2 is the classical example of the pivot joint, but this time they asked the superior radioulnar and inferior radioulnar. So no excuse with this joint topic. Here we talked about our different classification. Okay, agree everyone? So we can move further. Next, yes Christina, this is the intraosseous membrane. You are right. Now come to the our next part. See here, this was our general anatomy question. One question from the general anatomy. Can you tell me the answer? Frontal plane section is termed as general anatomy. One question, sure. This time joint topic 3 question. Yes. Sagittal section, this is the section which is dividing the body right and left half. Coronal section, which is dividing the body into the front and the back. So answer is B. Getting the point? Now try to understand the horizontal section, the plane which is dividing the body into the upper and lower part, and oblique section which is making angle. So answer in this part was the coronal section. Yes, one question from the general anatomy is sure. Now see here, these are the different image we had discussed. There is a sagittal plane dividing the body into the right and left part, frontal plane front and the back, and horizontal plane it is dividing the body into the upper and the lower part. Everybody agree? Now we are going to crack what are the different questions from the upper limb. So for the FMG, what is the analysis? Yes, remember in your December FMG 2022. One question sure from General Anat. General Anat, it is dry, hard, boring, and volatile. We never show the interest. But one question is surely asked because, especially the joint, 3 questions in your June FMG 2022. So read, don't leave this joint topic. Agree everyone? Fine. So just show me your love, your clappings, your thumbs up for the our next part. Yes, now we are going to talk about our upper limb. See here, we are going to talk about our this portion. Yes, this is the question. Identify the marked boundaries of the anatomical snub box. So here was the image, and many times I taught you. Yes, see here, extend the thumb. At the base of the thumb, there is one triangular depression. Can you see? Yes, there is a triangular depression. This structure is used for the snuffing. जैसे कि हम कोई ड्रग अब्यूज करते टोबैको. In this way, in the similar way, the drug abuse substance, it is taken at the base of the thumb. It is just rubbed and then snuffed. Okay. Yes, this structure is in our anatomy. ये हमारी बॉडी में है. It is used for the snuffing and it is box-like structure. That's why anatomical snub box. Okay. So here there was the boundaries we are asked. So exact pattern, entry boundary, posterior boundary, these all are there. I taught you during the clinical, during our discussion. See here, I taught you all the boundaries. Also the clinical, I told you there are the 3 clinical. First was the our wrist. Yes, everything is written in our class notebook. We had seen that anatomical snub box, it is having the boundaries, entry boundary, posterior boundary. Okay, and I told you one mnemonic, one trick also. आगे longus, पीछे longus, बीच में brevis. Yes, anterior longus, posterior longus, between brevis. So when you are doing the abduction of the thumb, anteriorly there is the muscle. This is abductor attached to the thumb. That's the pollicis longus. आगे longus. Entry boundary is formed by the abductor pollicis longus. Here was the image. Yes, this was the abductor pollicis longus. And the brother close to it, that is the extensor pollicis brevis. And when you will extend the thumb, feel it. Anatomy अपनी body में पढ़ो. Yes. On the back side, there is one more tendon that is extending the thumb. This is our extensor pollicis longus. Getting the point? So entry boundary, also you can say according to the anatomical position, this is the anterolateral boundary. Getting the point? Okay. While there is our posterior boundary, also you can say posteromedial boundary. Okay, so these are the boundaries. I told you the roof, always the roof is formed by the skin, superficial fascia, deep fascia. Yes, at the roof there was the radial nerve. If it is compressed due to the tight wristwatch, then it is known as the tight wristwatch neuropathy. That is also known as the chiralgia paresthesia. And at time of the class, I told you the brother of the chiralgia paresthesia, that was the our meralgia paresthesia. Getting the point? Okay, so you have to remember that chiralgia paresthesia and the meralgia paresthesia. और यहाँ पर हमने गाना गाया था, meralgia, मेरा लेजिया. Okay, always in romantic way in our Bollywood there is the one statement, उसने मेरा जिया ले लिया, मेरा ले जिया. Yes, meralgia paresthesia, very important question. The compression of the lateral cutaneous of the thigh, lateral cutaneous of the thigh is compressed, then there is a meralgia paresthesia. But this is the tight wristwatch neuropathy. Radial nerve is compressed due to the our tight wristwatch at the anatomical snub box. This is known as our chiralgia paresthesia. Okay, Salman Khan is wearing the very loose wristband. Okay, why? Because he is aware, उसको पता है कि अगर उसने tight wristwatch पहना तो उसे chiralgia paresthesia हो जाएगा. So this is the clinical point. Another thing, here is the presence of the cephalic vein. Cephalic vein is used for the IV drip. Another thing I told you, there is the our floor. At the floor there is the escapoid bone, and this escapoid bone is the second most common bone which is getting avascular necrosis. Orthopedics integration. The avascular necrosis. There are the 3 bones. First is the our femur, head of the femur, neck of the femur. Second is the talus, and second is the escaphoid, and third is the talus. And in ortho, escaphoid bone fracture had been asked. So actually from this topic, anatomical snub box, 2 questions had been asked. Direct question from the anatomy and indirect question from the orthopedics. Okay, so don't leave this question pattern. Okay, yes, hope Kehri you are enjoying. Yes, Mr. X, definitely these all the sessions are very helpful, so revise, keep an eye over your recent question pattern. Definitely you will crack the upcoming question. So remember, this is very important topic, directly or indirectly, because many clinical points are related with this anatomical snub box. Okay, so this was the question. Now see here, in June FMG 2022, another question from the our upper limb part. Yes, so can you try? Yes, Zenith, we will see all the questions better. This is not purely the anatomy part. Yes, it is the integrated anatomy. So this is the direct question from the anatomy. See here, action performed by marked muscle. So can you tell me, identify this muscle first? See here, this is our spine of scapula. This is the topmost acro part. That's why this is the acromion process of the scapula. So if this is the spine, so muscle visible above the spine of scapula, that will be supraspinatus. Muscle which is below the spine of scapula, क्या नाम होना चाहिए? Always I told to the my student, yes, शेक्सपियर ने कहा है, अर्ज किया है, तो इसी बात पे अर्ज हो जाए, अर्ज किया है, शेक्सपियर ने कहा है, नाम में क्या रखा है, लेकिन मियां गालिब कहते हैं सारे राज नाम में दफन रहते हैं. Try to understand, this is the muscle which is below the spine. So what should be the name? It is below, that's why infra. Spine of scapula, that's why spinatus. Getting the point? Yes. This muscle is rounded in nature. Yes, sir. This muscle is a little bit rounded. So this is known as teres. Teres means rounded, and it is small in shape. That's why minor. And here you can see comparatively bigger muscle. That's why this is our teres. Big muscle. That's why major. What I want to tell you, break the name and get the idea. And here this muscle is having the 3 heads. Can you see? 1, 2, and 3. 3 heads. That's why this is triceps. So definitely this shown muscle is our supraspinatus. So can you tell me what is the action of this supraspinatus muscle? Yes. Yes, very nice, Osama. You are right. बेटा नाम में क्या रखा है? But सारे राज नाम में दफन रहते हैं. Tell me, what is the action of the supraspinatus? Do you remember earlier concept was 0 to 15 degree supraspinatus, 15 to 90 degree that is done by the deltoid, and then 90 to 180 degree this is performed by the our serratus anterior and trapezius. Okay, so supraspinatus is responsible for the abduction. Getting the point? Yes, it is causing the abduction. Apply the logic. अगर आप नहीं भी जान रहे, कॉमन सेंस लगाएंगे तो बता सकते हैं. When this muscle will contract, yes sir, when this muscle is contracting, then our humerus will be pulled in this way, and the movement away from the midline, that is the abduction. Okay, so this is the our question pattern. Now try to understand. At time of the class in my PPT I show this image. This is the image of the our rotator cuff. Yes, all this sits muscle, they fuses together around the our head of the humerus. Can you see here? Yes, SIT. These are attached to the greater tubercle, and lesser tubercle is having the attachment of the subscapularis. Except teres major. Teres major is attached at this part. The teres major, it is attached at the medial border of the intertubercular sulcus. So it is not related to the our shoulder joint part. That's why teres major is not included. Okay, got the point? Now try to understand. At that time there is the one slide which I showed to the student, one update. See here, this is the update. Try to understand. Right now the 42nd edition of the Gray's Anatomy, but here is a reference from the our chapter number 48 and the page number 823 Gray's Anatomy. It is writing that there is the conventional view, and there is the evidence that both supraspinatus and deltoid are involved throughout the range of abduction, including initiation. and our BD Chaurasi sir, he is also writing 0 to 15 degree is controversial. Both supraspinatus and deltoid are involved in the initiation and abduction. So this is one update you have to be alert for this. What you have to remember that, yes, see here, earlier view that abduction of the shoulder 0 degree to 15 degree, it was caused by the supraspinatus, correct. Then 15 degree to 90 degree, it is done by the our muscle deltoid, okay sir, and 90 degree to 180 degree, it is done by the serratus anterior plus trapezius. But this is your old theory. Now the new theory, what it is saying, yes, this is the update. Remember this one published in our Gray's Anatomy. What you have to remember that 0 degree to 90 degree movement is done by the supraspinatus and deltoid, and this is same 90 degree to 180 degree is performed by the serratus anterior and trapezius. So this is the thing which you have to follow. Supraspinatus and deltoid both are causing from initiation up to the 90 degree. Don't follow the old rule. But even if you are not knowing the new concept, even then you can solve this question. Supraspinatus is causing the abduction of the shoulder joint. Agree everyone? Yes, definitely dear. December 2022 has been started. Right now there is the class from the Delhi for our Trivandrum student. Okay, so classes have been started. Yes, and for any kind of the detail, please contact our NLC center. Now see here, we are going to look for the next. See here, we had already discussed the upper limb part is important because in FMG 2021 the question had been asked about the nerve. Can you tell me what is the answer? Leprosy was the treatment. Leprosy treatment was running. Okay, so which nerve is involved? And in the image there was the ulnar claw hand. So tell me what is your answer? Yes. So Christina is correct here. Christina is giving the answer ulnar nerve. Yes, the nerve topic is important for our clinical. Now can you tell me, definitely the questions are asked from the our, yes, nerve from the upper limb directly or indirectly. So this is our previous year question, so don't skip this pattern. Okay, nerve of the upper limb you have to read. Right now indirectly this question had been asked. Okay, so can you tell me the answer is, this is our humerus, there is a shaft of the humerus, fracture is here, and there is the inability to extend his wrist. So patient is not able to extend the wrist. This is your wrist drop. Okay, also there is the loss of sensation over the dorsum aspect of the hand. So dermatome of the lateral side of the hand has gone. So definitely your answer is radial nerve. Yes, correct Christina, you are right. Preeti Rani, you are also right beta. Fine. So now we are going to look for this our another very important relation. We had already discussed at the surgical neck of the humerus there is the axillary nerve, at the shaft of the humerus there is the radial nerve, and behind the medial epicondyle there is the our ulnar nerve. One more nerve is there, that is our median nerve, which is running at the supracondylar area. So these are getting fracture. Okay, these are getting the fracture in the our different situation. The question will be asked with the radiology integrating to the orthopedics, and then question will ask about the anatomy. So that will be the pattern. The question will jump from the radio to the ortho to the anat. So don't leave this question for the FMG 2022 for the year December. This is not only the previous year. Yes, recent June question pattern discussion. This is the analysis. What is the question is going to be asked in your December exam. So there is the very important topic, joint nerves of the upper limb. And right now there was the question over the abduction. Fine, because there is the one update, so stay alert for that. Okay, now see here, this was the our 2021 question. Again, the biceps muscle in the flexion. So answer was yes. Tell me the answer. I described you that biceps is contracting and it is causing the flexion. So this is our prime mover. Triceps is just opposing. So this is the antagonist. Okay. Brachioradialis is supporting this movement. So this is the synergist, and the muscles which are fixing this our shoulder joint and helping in the movement, That is our fixator. So here the answer, tell me what is your answer? Correct. Correct. Preeti is correct. Aditya is correct. Answer is prime mover. Biceps is prime mover. It is agonist. Okay. So this is the general knot question also. Now see here our integrated pattern. Can you see? When you are having the proper knowledge of the upper limb, then you can solve this all the question. So there was the anot ortho integration. Can you see? There was the one image and question had been asked. One patient was falling on the outstretched hand. With the help of the anatomy, how can we do this orthopedics question? For management, the doctor's ties glass holding cast. Can you see? This is the glass holding cast. Suppose this is the glass. Patient is asked to maintain such kind of the position. Okay, that is the glass holding cast. Yes, when we are holding the cast in this way, then thumb is coming aligned to the scaphoid bone and our radius part. Getting the point? Okay, so what is happening? Which fracture is this? So you will see in your orthopedics part, this is our fracture of the scaphoid bone. Are you getting the point? I told you this scaphoid bone is getting easily fractured when we fall with the outstretched hand, and it is also second most common bone getting avascular necrosis. MCQ. Another thing that it is making the floor of anatomical snub box. So indirectly the same thing has been asked. Okay, so remember, this is your glass holding position. Just you have to put the glass in between the fingers. Yes, this is your glass holding position. You can see there is the fracture of the our scaphoid. Yes, you know this is the scaphoid. She looks too pretty, try to catch her. That is the way. Okay, so also you have to know this all the points, our anatomy and orthopedics integration. You also see in anatomy there is the fracture of the distal end of the radius that results in the dinner fork deformity. This is nothing, this is our Pollicis fracture. So there is the fracture of the distal end of the our radius. Okay, yes, you will see in case of the Pollicis fracture, this is the ortho topic you will see in the ortho. But remember, upper limb is important, and on the basis of the our upper limb anatomy, you can make strong and stronger your orthopedics and the surgery. So if any patient is falling in this way, so outward displacement is there, that is a Pollicis fracture, and just opposite inward palmar side displacement, then it is the Smith fracture. And there is the X-ray. When you are able to identify the osteology part, then you will be able to read the radiology part. Okay, so you can see here there is the fracture of the ulna Monteggia fracture. So you can remember the trick MU. In case of the Monteggia fracture, there is a fracture of the ulna, generally the proximal 1/3, while just opposite to it there is the fracture of the our distal radius. This is known as the Galeazzi fracture. You can remember the G for Galeazzi fracture, R for radius. So there is a one beautiful mnemonic from the internet sources, the mugger. M for Monteggia fracture, there is a fracture of the ulna. Okay, G for Galeazzi fracture, there is the our fracture of the radius. So you can remember in this way. Monteggia fracture, last word is the A is the first letter, so there is a proximal fracture. Yes, Galeazzi, there is a Z word, Z is last word, so this is distal fracture of the ulna. So this is the one way you will cover in your orthopedics, but try to integrate anatomy and orthopedics. In this way you can learn better the anatomy, you can learn better the orthopedics. So this session, again I want to tell you, this is not only the discussion of the anatomy questions, it is the discussion for the anatomy and anatomy related integrated questions. Okay, so you will cover the many things in the similar way we had discussed. Okay, now we are going to look this our anatomy and the orthopedics questions. Tell me, this is the ortho question. Okay, a patient comes to the OPD with the pain and swelling in his vein. The X-ray was given below. What is your diagnosis? Yes, so X-ray radiology question you can read only when you are having the proper knowledge of the osteology. Can you see this is our styloid process? So definitely this is the our radius, and this is the thin bone, that's why this is definitely the ulna. So you can mark the she looks too pretty, try to catch her, and our phalanges. Yes, you can see this is the most thick, that's why this is our first metacarpal. You can see there is the swelling in the radius, and you can observe there is the bubble kind appearance. This is our soap bubble appearance which is found in, tell me, this is the ortho question. This is the ortho question. Yes, Devanjan, you are correct beta. Preeti Rani, you are also correct beta. This is your giant cell tumor. Now see here, this is the giant cell tumor. What you have to remember, 5E. E for epiphyseal tumor. Yes, E for expansile mass, E for eccentric mass, E for when you palpate this tumor, you will get the eggshell crackling, and for the treatment we are performing the en bloc excision. So remember, not ortho integration. Here is the involvement. It also occurs at the distal end of the radius ulna. It also occurs around the knee joint. Okay. Yes, this is soap bubble appearance. Very important fact. And here is the ortho. See here, not ortho and patho integration. Can you see giant cell tumor? There are the two important components. What are the two important components? You will see mononuclear cells. Okay, sir. But the very characteristic feature, that is the one large cell which is having the multiple nucleus. So this is the multi-nucleated giant cell. So this is your anatomy. Then we jumped to the ortho, and ortho integration. Radiology also we had seen the X-ray and the pathology. This will make the clear view for the recent next pattern, recent clinical based question, and it will make strong the anatomy, ortho, patho as well as radio. Okay, now see here, there was the, yes, this was, we are coming to this question. One more question, anatomy question you can say, orthopedics question you can say. Yes, clinical scene. The patient comes to the OPD with chief complaint of pain and swelling on the shoulder. Yes, a fracture of the clavicle was suspected. Yes, I told you clavicle is the beauty bone, which is the most common site of the fracture in the clavicle. So option was lateral 1/3, junction of the medial 2/3 and lateral 1/3, junction of the medial 1/3 and lateral 2/3, and medial 1/3. So can you tell me the answer? So Preeti Rani is saying the B or C. Christina is saying the B. Okay. Yes. See here. Yes, 30 pages. See here. There are the approximately 12 questions directly from the our that rapid revision, but in integrated pattern. When you will see integration, I told you the topics. Yes, Amir Hassan, I am talking about the topics. When you will see the topics, then you will get approximately 50 questions from that 30 pages. I am talking topics, I am not talking about the question. Yes, direct question, approximately 12 question of the anatomy. I think 15-16 question directly from the anatomy, among which 12 question directly from our booklet. Okay, and if you will talk about our integrated pattern, then many topics, ortho, surgery. Also we talked about our biochemistry. Also we talked about our obs gynae. Yes, approximately 50 topics directly indirectly came from that part. Okay, so focus for your previous year question paper, extract the pattern. 80% of the topics you can guess. I am telling you the topics, not exact line to line question. So try to focus over this question. Yes, again, orthopedics. See here, I told you with the three-dimensional anatomy. See here, this is our upper limb part. Yes, sir. Here you can see the beauty bone clavicle. This clavicle is having the curvature. Yes, medial 2/3 and lateral 1/3. And I told you one update according to the Gray's Anatomy. Now it is having the medial 3/5 and lateral 2/5. Okay, sir. Now try to look here. There was the classification. This was the Allman classification according to the orthopedics. The fracture in the lateral 1/3 is 15%. Fracture in the medial 1/3 is the 5%, and most common fracture site is the our middle 1/3, that is the 80%. Middle 1/3 it is getting the most common fracture because the curvature is here. So when we fall with the outstretched hand, maximum pressure is coming here, and middle 1/3 of the clavicle is getting fracture. But in this question, middle 1/3 was not given, medial 1/3 was given. So at time of the exam, be attentive. Okay, getting the point? So this D is not the answer. D is not the answer. Yes, A is not the answer. Fine. You know, Medial 2/3 and lateral 1/3. Anatomy textbook, they are also saying the medial 2/3 and lateral 1/3, that is the junction. So this junction is comparatively weak part, so you have to opt the B. Remember, the best answer is middle 1/3, 80%. But if it is not given, then you will mark the another question. Okay, then you have to mark the single best answer according to which this B is best answer. Okay, so getting the point, this is your clavicular fracture case. You can observe here. Yes, here this one. Fine. You can see when there is the fracture, at that time the sternocleidomastoid, it will pull the medial side upside, while the lateral part is pulled due to the gravity, due to the deltoid downside. Okay, now that was the discussion about the upper limb. Getting the point, beta? Fine. Yes, welcome Amir Hassan. Now we are going to talk about our topics asked from the lower limb. Okay, see here, I told you the question pattern already. We discussed all the arteries. See here, go at the page number 16 from our 30-page rapid revision of anatomy. We had already discussed entire arterial supply of the lower limb. Very simple story. Abdominal aorta is coming, it is dividing the common iliac artery, which is dividing into internal and external iliac artery. Then this artery was coming as the femoral artery, then it was running in the popliteal fossa, popliteal artery, then anteritibial artery, then posterior artery. Anteritibial artery was making the dorsalis pedis artery, and then it was making the arcuate artery. Posterior artery is palpable behind our medial malleus. Many times I had told you. Okay, and we had seen this was the question pattern from the FMG 2021. Again, I told you that question was asked in the your FMG 2020. Yes, we discussed also the artery supply of the upper limb. Remember, always I speak in the class. Earlier the question was coming from the middle meningeal artery. Continuously 2017, 18 and 19 this question was asked. Now they are asking the especially the posterior tibial artery, and this posterior tibial artery, it was asked in the 2019, then 20, then 21 and also the 22. Different kind of the way they ask the question. So get ready for the next FMG December 2022, this posterior tibial artery. Otherwise, our question from the palpable arteries. Yes, because of the peripheral vascular disease, because of the Raynaud's phenomena, because of the Burgess disease, because of the thromboangiitis obliterans, all topics makes this our palpable artery very important. Okay, so this was already asked in FMG 2021. Getting the point? So can you tell me what is the answer? Which artery is palpable here? Yes, look carefully. This is our great toe, means it is medial side, and if it is the medial side, so this will be the medial malleolus. Getting the point? Just behind the medial malleus there is the posterior tibial artery. Between the medial and lateral malleus there is the anterior tibial artery, and dorsalis pedis artery is felt over our navicular bone. Definitely tell me the answer. Yes, very good, Palak Preeti. Answer is the posterior tibial artery. Fine. See here, same pattern FMG 2020. The clinical scenario was given and it was writing the posterior tibial artery at ankle. It was palpable. Where you will palpate? So we had already discussed in our class that it is palpated between the medial malleus and medial border of the tendocalcaneus in inversion position. So the same topic had been asked. No new question. Yes, this is our medial malleus where you can see the posterior tibial artery. So get ready for our December FMG 2022. Getting the point? Okay, so this is your discussion and analysis. We are taking the question. We are taking out the question. Can you see? December FMG 2021 question. Identify the marked bone. So can you tell me which one is the our marked bone? Why this question had been asked? This is the radiology question integrated with the anatomy. So this is the our radiology Anat conceptual brainstorming integration. Tell me what is the answer? Yes, correct, Preeti Rani. Yes. Persh Rai, yes, you are correct, beta. This is our navicular bone. See here, with the proper three-dimensional orientation, we had seen in our lower limb. Yes, we are enlarging just like the Iron Man, just like the Tony Stark, and we are looking here. Foot bone. This is the largest bone of the foot. This is our navicular bone. Just above the navicular bone, there is a talus, and in front of the talus bone, you can see, yes, that is the our calcaneum. Sorry, calcaneum. If I pronounce wrong, please improve this one. This is the largest bone of the foot, calcaneum. Above the calcaneum, there is a talus. In front of the talus, there is the navicular bone. In front of the navicular bone, there is a medial, intermediate, lateral cuneiforms, three cuneiforms, then first, second, third metatarsal. Just lateral to it, there is our cuboid bone, and there are the fourth and fifth metatarsal, and remaining are our phalanges. Okay, getting the point? So we had seen this all the things. Now see here, apply that thing. This is the very thick bone. So this is our first metatarsal, then second, third, fourth, fifth. Yes. Now see, if these are the metatarsal, so this is the medial, intermediate, lateral. Yes, these are our cuneiforms. And you can see there is a navicular shaped bone. So definitely this is our navicular bone. Okay. And here will be the talus. Talus is articulating with the navicular. Getting the point? Okay. Yes. Why I am telling you? See here, always I teach in my class the identification of the bone with proper drawing. And the arches of foot we always see. Here we discussed at the page number 16 this topic, and I told you always that arches of foot is important due to the different kind of the congenital anomaly. Okay, that is one of them, CTEV, because I told you that congenital talipes equinovarus is the most common congenital deformity all over the world among all kind of the diseases, either the metabolic diseases, yes, your glycogen storage diseases, yes, your phenylketonuria, your alkaptonuria, or the genetic syndrome, Down syndrome, Patau syndrome. Among all, the congenital talipes equinovarus is the most common deformity. That's why foot is important topic. And at time of the lecture, I told you one question definitely from the foot bones, because it is related to the arches of foot. Yes, this time direct question was not asked from our anatomy, but anat ortho integration, the congenital talipes equinovarus had been asked. Okay, so look this question in your orthopedics. Without the knowledge of the foot, bones of the foot, arches of the foot, you cannot understand this topic. The question was, 2-year baby is presented to the OPD by his worried parents. Yes, with the following complaint, and he came 6 months before, first time to the clinic, and that time no treatment. ओके 6 महीने पहले आया पेशेंट, लेकिन उस समय उसका कोई इलाज नहीं किया गया, नेग्लेक्ट कर दिया गया. ओके फाइन, बट नाउ ही अगेन केम. How would you manage this one? So this is the your ortho question. Go for the orthopedics teacher, they will tell you better. Yes, see here the answer is our manipulation and cast, but few students are also saying the serial cast was given. So go for the your ortho review. You can see this is your CTEV, also known as club foot. It is directly based on the our topic of the arches of foot. So last year 2021, the identification of the bone, this time the question from the arches of foot. So definitely get ready for the your December 2022, the question from the foot is going to be asked. Get ready for it. Okay, now see here, there was the one question I always told you, the largest seed like bone, that is the patella. Yes, see here beta, always at time of the discussion I told you that knee joint is important, and here is the largest seed like bone, patella is located. Yes, patellar fracture is important, the kneecap is important. Okay, yes, this knee joint is important, try to understand. Now if you are having the proper anatomy knowledge, then you can say Sir, this is our lower end of the femur. These are condyles. Here is the your tibia. This is your tibial tuberosity. Just apply the knowledge of the anatomy. You can see the fibula, the lateral bone, and this is our patella, which is getting fractured. Yes, this is our patella. Fine. Largest seed-like bone, sesamoid bone. Yes, what is the seed-like bone? What is the sesamoid bone? The bones which ossify after the birth, which are having the three no Haversian canal, no medullary cavity, no periosteum. They alters the direction of the pull of the muscle. Okay, so different seed-like bone you must know. And patella is, yes, can you tell me the answer for this not orthopedic? Yes, dancing medicos, very right, beta. Answer is the K wire, correct. Go for the your orthopedics discussion. Fine. Now see here the further. Whenever we start the abdomen topic, now we are coming to the abdomen. We start from the our six-pack abs of the our, yes, Ritik Roshan sir. So at time of the class, here upper limb we discussed all these muscles, all this clinical in the rapid revision. Yes, you can get this PDF at our platform, NLC platform, Dr. Shrikant Verma classes platform. Both platform you can get many free videos and the keynotes. You can get this PDF 30 pages anatomy. Different MCQs are here. Okay, so upper limb we discussed the our different signs. At this time the questions we are not directly asked from this part, but different tricks and mnemonics are here. Okay, and here the our all the nerves. Then we discussed about the our lower limb radial nerve injury also we talked, and this was the point from where directly question had been asked from our anatomical snub box. Okay, and this was our lower limb part, and question was asked from this our arches of foot topic from the rapid revision of the anatomy. Okay, see here you can follow the page number 16. Fine. And then we are looking for our abdomen topic. In the abdomen, see here always we start from this our beautiful six packs ab. So these are our different muscles, and at time of the class I told you that you must see the anterior abdominal wall. This was the my first dialogue at the abdomen class for the FMG 2022 December. Definitely damn sure one question from the anterior abdominal wall. Also for the your NEET PG exams, always one question asked. Why? Because if you are doing the gastro surgery, hepatobiliary surgery, any kind of surgery through the anterior abdominal wall, you are doing the cesarean section through the anterior abdominal wall, you have to pierce the 8 layers. So I always teach the students the 8 layers of the abdomen, and on the basis of these 8 layers you can easily learn the boundaries of the our inguinal hernia. Okay, and inguinal hernia, this all the question beta yahan se question bhar ke aata hai. Okay, yes, it is the hernia topic, inguinal hernia, but inguinal hernia is the topic related to the our anterior abdominal wall. So this is the question from your surgery. Yes, integration. There was the question that deep inguinal ring is found where? Yes, FMG 2020, FMG 2021. Every year they are asking this question. Yes, question hai beta. Neurovascular bundle in the abdomen runs in between. Yes, this is the question. तो आप कैसे बोल सकते हो if this question is going to be asked in the your 2021, definitely it should be asked in your 2022. और यही हुआ, एंट्री abdominal wall से क्वेश्चन आए. Get ready in your 2022 December, directly or indirectly entry abdominal wall will be asked. Okay, so you can follow this topic at the page number 2022. Yes, see here what the different question had been asked. Here first question. Actually this is the question from the our basics of the anatomy, general anatomy part, introduction of the abdomen. See here there are the certain planes which divides the our abdomen into the 9 quadrant. Getting the point? Yes, these are our 2 vertical lines which are passing through the mid clavicle part. So these are the mid clavicular line. Getting the point? Fine. Can you see this is the our margin of the rib. So this is our, yes, subcostal plane, because it is passing through the our lower margin of the rib, and it is passing through the our, yes, hip bone tubercle part. This is our transtubercular plane. Yes, 9 quadrant, it is divided by one line. One more line you have to show that passes through the pyloric part of the stomach, that is a transpyloric plane. So these are the different plane. So this was the very old question pattern which was recently disappeared but again came into the pattern. So try to understand. Yes, this is the old image from our respected B.D. Chaurasia sir textbook. See here, there is the one plane, transpyloric plane, which passes through the pylorus of the stomach. Getting the point? Yes, it passes through our pylorus of the stomach. That's why transpylorus. Yes, it passes from the first lumbar vertebra. Okay, sir. L1. Transpyloric plane. Stomach is above. Okay, sir. L1 is above. You can remember MCQ. Now see, there is the one more plane which is passing through the hip bone tubercle part. This is the transtubercular plane. It is the lowest line, so it is passing through the last lumbar vertebra, L5. It is so easy, it is so easy, it is so easy, it is so easy. Getting the point, everybody? Okay? अब नहीं भूलना इस टॉपिक को. फिर से मैं आपको बता दूं, this question was asked previously, then disappeared, and now again came into the pattern. So now we are focusing. ये कोई नया क्वेश्चन नहीं है. Okay? What I want to tell you, transpyloric plane. First plane is passing through the first lumbar vertebra. Last plane is passing through the last lumbar vertebra. So easy. But more specifically, this is passing through the lower border of the first vertebra, and our transtubercular plane, it is passing through the upper border. See here, L1, you can remember upper border. L5, you can remember the lower border. So easy. भूलना ही नहीं है. भूलना ही नहीं है. The transpyloric plane, it passes through the upper border of L1. Sorry. Please improve. This is your lower, and here is your upper. Please improve. Sorry for the mistake. Yes, this is your upper. Okay, गलती से mistake हो गया, जोश में. बहुत मजा आ रहा है. Yes, do discussion with your friends. And then you will get excitement, you will get the pleasure of the study. आज की हमने क्लास में देखा पैपिज सर्किट और फॉर्निक्स का क्या रोल है. यस, इट एक्टिवेट्स द सिंगुलेट गायरस व्हिच गिव्स द प्लीजर. सो प्लीजर में गलती से मिस्टेक हो गया. वी आर इंप्रूविंग. व्हाट यू हैव टू रिमेंबर दैट L1, लोअर बॉर्डर ऑफ द L1, यहां से जाता है पहला प्लेन. L1 पहला प्लेन. लास्ट प्लेन कौन है? ट्रांसट्यूबरकुलर. इट इज पासिंग थ्रू द अवर L5 part. Yes, it is passing through the upper border. Getting the point? But can you see there is a one subcostal. This is the rib margin. Yes, this is your rib margin. यहां से बेटा आपका कौन सा प्लेन जा रहा है? This is your subcostal plane. Getting the point? Yes, it is our subcostal plane. कहां से जा रहा है? L1 और L5. इनके बीच में कौन आएगा? L3. Are you getting the point? So easy. Now you can remember L1, L2, L3, L4, L5. What you have to focus from the our L2 and L4, no lines are passing. From the L1, transpyloric plane is passing. From the L3, subcostal plane is passing, and from the L5, transtubercular plane is passing. Right now the question had been asked for this our subcostal plane. Okay, so you can see that this subcostal plane is passing through the upper border of the L3. And now very interesting question from our old B.D. Chaurasia textbook, that umbilicus is located at the junction of L3 L4. Do you remember? This is the NEET 2019 question. लोग umbilicus के पीछे पड़े हुए हैं. Umbilicus is supplied by the T10 nerve dermatome. Yes, it was the recent question, and this T10 is supplying the appendix, testis and small intestine. That's why the referred pain of the testis is felt at the umbilicus. Umbilicus बेटा बहुत important structure है. Embryologically, it is the connection of the three system. What are the three system which are connected with it? Yes, First is your cardiovascular system with the help of the placenta. Second is our urinary system, excretory system with the help of the urachus. And our third structure, that is GIT through the vitreointestinal duct. And previously embryologically the umbilicus was defective. ये भी कोई नया टॉपिक नहीं है. Previously the question in the FMG 2021 is all they had been asked about the question that one patient is coming with the fecal material. Yes, fecal material coming from the umbilicus, embryology question, that was the fecal fistula. And one other question, one patient was coming, one baby was coming, and urine was coming from the umbilicus. So umbilicus is very hot topic, so you cannot say that this is the new question topic. Topic is same, yes, they ask different question within that topic. Okay, so all things are clear. Can you tell me what is the answer? What is the plane? Yes, this is plane which is passing below the our rib margin. So what you will mark? T12, L1, L2, L3. Tell me what is the answer, beta. Yes, Sparsh is correct. You are right, beta. Yes, answer is D. So Ganesh, yes, thank you, beta, thank you. Ganesh is enjoying this session. Yes, just give me the clapping, just give me your emojis, just give me your heart, just give me your fire, whatever. If you're liking the session, please give me the your any kind of the emoji. Hope you all are liking the point. Yes, Preeti Rani is here, Christina is here, Sparsh is here, Ganesh is here, Raunak Patel is here. Yes, Shobit is here. So hope you all are enjoying the session. Okay, so yes, thank you Aditya, thank you. So Aditya, Preeti, Krishna, these all are our students from the Trivandrum. Yes, Delhi session is running right now. Thank you everybody. Now we are going to talk about the our next question. Yes, लोग umbilicus के पीछे पड़े हुए हैं, नीट वाले भी पड़े हुए हैं. They are asking about the dermatome. Fine. FMG exam. Yes, see here what are the different question. NEET PG 2009 question was supplied by T10er. Yes, then FMG 20 and 21 they asked for the umbilicus question. There was the question related with the urachal fistula. Yes, urachal fistula. And there was the question for the your fecal fistula. Yes, that is also related with the our umbilicus topic. Now this time they ask about the vertebral level. Remember, they are asking about the vertebral level. Getting the point? So right now I just described you about the position from the BD Chaurasi sir old book. Yes, it is situated just between the L3 L4. So answer will be C, correct. But suppose we are not aware. So do you remember I told you one fact at time of the our abdomen discussion? Yes sir, this is our esophagus, here is our stomach, and then it is our duodenum. Getting the point? And then there will be the our intestine. Remember, this all structures are above the umbilicus in our epigastric region. Fine. And I told you the parts of the duodenum, you all are aware, D1, D2, D3, D4. I told you the first part of the duodenum at the level of L1, the second part of the duodenum at the level of L2, and third part of the duodenum at the level of L3. Please recall, it is we discussed at time of our anatomy class. Just common sense we have to apply. And I told you just about it, there is the location of the foramen of Winslow. So your NEET question, the foramen of Winslow is situated where? Definitely it is situated above the level of the L1, that is our T12. This was the our NEET pattern. Okay, now this time question asked about the umbilicus. So can you tell me umbilicus is situated where? Definitely it is situated below the L3 but above the L4. So you can use your common sense. Yes, कॉमन सेंस इज द थिंग विच इज नॉट कॉमन. थोड़ा सा हमको शांत रहना, कूल रहना, रिलैक्स रहना, थोड़ा सा लॉजिक लगाना है, आप आसानी से इसको क्रैक कर सकते हो. गेटिंग द पॉइंट? यस, ट्राई टू लुक इन आवर abdomen session. See here the different vertebral level. I told you about the celiac trunk, about the our supramesenteric artery, inframesenteric artery, part of the GIT. Yes, esophagus is very important topic. Different vertebral level we had learned here. Okay, and yes, all the arteries we had seen. And here I told you, see here, go for that rapid revision part, page number 24. Okay, yes, not the direct question but indirectly you can apply the logic. फिर से मैं आपको कहना चाहता हूं कि जिस दिन आप एग्जाम देना चाहते हैं तो बेटा वो सिर्फ इस चीज का एग्जाम नहीं है कि आपने कितनी पढ़ाई की है, ये एग्जाम इस चीज का है कि डिफिकल्ट टाइम में आप किस तरीके से बिहेव करते हो. ट्राई टू अंडरस्टैंड. आई वांट टू टेक योर टाइम. यस, एक वार्ड है, वहां पर एक पेशेंट क्रिटिकल सिचुएशन में उसकी जान जा रही है. नाउ व्हाट इज हैपनिंग? यस, relative, family relative, they are asking for the ward boy. Yes, please come, he is in the critical situation, please save the life. Yes, और ward boy जो है वो घबरा जा रहा है. He is calling to the nurse. Nurse is also watching and yes, she is also haphazard. Now she is calling to the intern. Intern भी देख रहा है मुझको तो कुछ नहीं आया. Now he is calling to the consultant. Consultant is coming and he is also saying, oh wow, what can I do, what can I do. तब वो आपको बुलाता है और आप आते हो. Yes, आप भी कुछ नहीं कर सकते क्योंकि बेटा इलाज जो है वो डॉक्टर करता है लेकिन बचाने वाला तो ऊपर वाला है. यस, वी ऑल आर जस्ट मीडिया. लेकिन जब आप आते हो आप एक पेशेंस रखते हो, कूल रहते हो, काम रहते हो, आप बोलते हो साइड हटो, साइड हटो, मैं देख रहा हूं. नाउ यू आर होल्डिंग द पल्स एंड यू आर थिंकिंग अब क्या करूं, पता आपको भी नहीं है. हाउ कैन यू जज विद इन द फ्यू सेकंड, फ्यू मिनट्स दैट व्हाट इज द सिचुएशन? बट यू आर नॉट लूजिंग योर कॉन्फिडेंस, यू आर नॉट losing your temper. Getting the point? Now you are applying. Okay, yes, after this apply the BP apparatus. Yes, take the proper all the vitals, IV drip चढ़ा दो. Yes, then whatever the things are available, yes, go for the oxygen. I'm just giving one simple example. और होता क्या है after the few minutes? Yes, due to the homeostatic mechanism, body is adapting the situation and patient is saving. Yes, many time patient cannot be saved. लेकिन किसी पेशेंट को बचाना या मारना हमारे हाथ में नहीं है. we can only try to save the life of the patient. okay, और जब पेशेंट की जान बच जाती है, आपने कुछ किया नहीं, आपने जस्ट सपोर्ट किया, तो बोलते अरे वो डॉक्टर बहुत अच्छा है, घबराता नहीं है, उसने बहुत अच्छे से मैनेज किया. yes, you are not losing your confidence. Same thing. Now come to the our exams. Try to understand. Yes, try to understand at time of exam. You are going for the exam. आपने बहुत अच्छी सी स्टडी की है, लेकिन बेटा ये एग्जाम सिर्फ स्टडी का नहीं है. हाउ यू आर बिहेविंग एट टाइम ऑफ द एग्जाम. आपको घबराना नहीं उस डॉक्टर की तरफ. यू हैव टू फाइट. मे बी यू हैव टू फाइट विथ योर ऑटो ड्राइवर, यू हैव टू फाइट विथ द सिक्योरिटी पर्सन एट टाइम ऑफ द एग्जाम. यस, हो सकता है एग्जाम में आपका इंटरनेट प्रॉपर वर्क ना करे, सिस्टम वर्क ना करे. यस, यू आर गिवन द एक्स्ट्रा टाइम. But what is happening? Other students they are going away. Other persons they are going, और आप घबरा जा रहे हो. Yes, remember, exam is not the exam only for this that you had studied. आपने देखा होगा कई सारे ऐसे लोग हैं कम पढ़े हैं, उनका सिलेक्शन होता है, and there are the many students who studied too much, but they are not getting selection. Why? Just due to the mentality. That's why grand test is important. Test revision is important. So this was the same question. Okay, fine. Yes, so we are going to look for this. Yes, so Keval Singh is asking for the शायरी. तो अर्ज किया है, रहने दे आसमां जमी की तलाश कर, सब कुछ यही है कहीं और नहीं तलाश कर. हर आरजू पूरी हो तो जीने का क्या मजा है, जीने के लिए कम से कम एक कमी की तलाश कर, एक कमी की तलाश कर. So remember, you will get everything. Just keep patience. So you can see here D1 is located at the L1. D2 is located. Yes, you can see the D2 is located at L2 and D3 is located at the vertebral level of L3 and umbilicus is just below to this our duodenum part. So definitely it is at the junction of the L3 and L4. So you can crack that question from here. Also we had seen the portal vein, portal hypertension. Go for the our page number 24. Okay beta, everybody, are you getting the point? Okay, yes, Dr. Nivedita, thank you beta, thank you. So we are coming again for this our integrated discussion. See here, so answer is the our See, agree everyone? Umbilicus is important topic. Yes. See here, anterior abdominal wall question. Neurovascular bundle in abdomen runs between. Yes, FMG 2021. I want to highlight. This is the discussion and analysis session. I want to highlight that this is the pattern which is going to come in your FMG 2022 December. What the topic I am highlighting? Anterior abdominal wall. So till now, what I told you, joint. One question. Yes, nerves of upper limb. Another topic which is very important. Yes, arteries, especially the palpable arteries. Another question. And one more thing, the foot, and this time anterior abdominal wall. Yes, 1, 2, 3, 4, 5. 5 topics till now which are going to ask in your FMG December on the basis of this anatomy integrated discussion session. Sure. Don't miss this one. Okay, now try to understand. Yes, neurovascular bundle. Do you remember I told you VAN? I told you the Hilton law. जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. That all the theory, general and not part. Yes, neurovascular bundle. It runs between which layer? So here you will see the skin. Then there is the superficial fascia. Deep fascia is absent. There is the external oblique. There is the internal oblique. There is the transversus abdominis. Can you see this neurovascular bundle is running here between the second and third layer of the muscle? Yes, it is running in between the, you can observe properly between internal oblique and transversus abdominis. So your answer is internal oblique and transversus abdominis. Getting the point? Yes, I told you at the time of the thorax that neurovascular bundle, just like the thorax, it is running in the abdomen. It is running in between the first, second and third. So in between the second and the third muscle, this is the VAN, van was structures. These are running between the second and third layer in our thorax, between the external intercostal, internal intercostal, and this is the innermost intercostal. Same in our abdomen, external oblique like the external intercostal, internal oblique like the internal intercostal, and just like the our transversus thoracis, there is a transversus abdominis muscle. So both, either the thorax or the abdomen, both part, the neurovascular bundle is running between the our second muscle layer and the third muscle layer. This neurovascular bundle is important. What I want to tell you, neurovascular bundle, this was the question in AIMS May 2018, which was now repeated in the FMG. Again, I want to tell you better that questions which are asked in the INICET, they are repeated in the NEET. From the NEET, that questions are asked in the FMG exam. You must know the neurovascular bundle. Yes, in AIMS, the question had been asked, which compartment of the leg is not having the neurovascular bundle? And answer was our superficial posterior compartment. Right now, this question pattern, again, what I want to tell you, anterior abdominal wall is important topic. Agree everyone? Now we are going to talk about this deep inguinal ring is found in. Can you tell me, this is the question from our not surgery integration? Yes, answer is our fascia transversalis. Remember, deep inguinal ring is the fascia transversalis. Go for our surgery portion. Yes, FMG 2021, again it is the topic of the hernia related with anterior abdominal wall. A patient presented with the hernia, content is the spermatic cord which is passing through the external oblique muscle, outside muscle. So it is coming from the external oblique, okay, not through the our, yes, remember, fascia transversalis part, directly it is coming out. That's why you will say this is our direct inguinal hernia. Getting the point? Now try to understand these all the things we discussed at the page number 22. So you can focus for this all. Now we are going to talk about our head and neck session. Can you see here, head and neck session FMG 2022? Okay, yes, there is the not complete our options, but see here, I am lacking here, incomplete. You can tell me what is the our option. See here, patient underwent surgery. So this is our surgery and not integration. submandibular gland, which is the topic of the ENT. So surgery and not ENT integration, during which a suspected injury to the hypoglossal nerve, clear cut it is writing the hypoglossal nerve. So here is the role of the our which subject, anatomy. Okay, so there is an anat. So which clinical feature will be seen? Okay, deviation of the tongue to the same side, deviation of the tongue to the opposite side, inability to protrude the tongue, and D is any option. Okay, so just to try to understand. Yes, we are coming to that part. But see here, there was a question from the FMG 2021 to identify the structure. And at time of the discussion, yes, we had discussed in this way. Today at the Trivandrum class, we had seen this all the image and different discussion we did. Yes, I told that there is a one muscle which is coming from the genian tubercle going to the tongue. When this muscle will contract, it will cause protrusion of the tongue. Genioglossus, all the things we had seen, the safety muscle of the tongue. This was the question from the FMG 2000, I think that was 19. Okay, so right now the same question had been asked in the 2022. See here, such kind of the image. Yes, first recent question I am telling you, this is our mandible. Yes, what I told you, that whenever there is a cadaveric image, never get under the tension. Just try to understand. Can you see, this is the nose, it is the mouth. Can you identify this one? Whenever cadaveric images are asked, just to pick any silly point, तो सबसे बेवकूफ टाइप का पॉइंट लगे उसको उठाओ, आसान बनाओ. So yes, you can identify this one. So this is anterior and here is posterior. Okay, recent question. Earlier 2019 they asked about the one muscle which is the fan shaped muscle, genian tubercle to the tongue. When this muscle contract, then it will pull the tongue to the front side. So this is very respectful muscle. We are saying GG. You know GG. We give the respect. Modi ji, Kejri ji, Kejriwal ji, yes, Rahul ji, Amir ji, Shahrukh ji. But this muscle is the most respectful. We are giving the 2 times G. This is the GG. Just one funny way so that you can remember this muscle. This is genioglossus, genian tubercle to the tongue. This is the genioglossus. It is responsible for the, when this muscle will contract, it is responsible for the protrusion of the tongue. Yes, sir. This is the word tongue. There are the our right genioglossus. There is our left genioglossus. When these two muscle contracts, apply the physics, it will go straight forward. But try to understand. Yes, suppose this side, yes, suppose this is left side, left genioglossus is atrophied. Okay sir, now it is not working. So this will be stronger and it will pull the tongue forward, but this tongue will be deviated in this way. Getting the point? Because this muscle is stronger, so it will go in this way. So if left 12th nerve, yes, 12th nerve, it is the nerve of the tongue. It supplies all the muscles of the tongue except palatoglossus. So genioglossus is supplied by the 12th nerve. So left 12th nerve is, if damaged. Getting the point? Then what will happen? It is deviating to the left side. Means remember, 12th cranial nerve damage, it causes ipsilateral deviation. So nice. Okay, not the opposite side. Do imagination. There is the right genioglossus, left genioglossus. Apply the physics vector. Suppose if left side is weak, so right side will go front, and it is strong. So it will pull to the, it will push to the opposite side because this side is strong. So remember, ipsilateral deviation. If the left side is damaged, tongue will go left side. If right side is damaged, tongue will go right side. So just by asking the patient about the protrusion of the tongue, you can identify the cranial nerve injury. Okay, and how to see the different structures? Yes, I'm just telling you the one short view. I told you the way CSF. So can you tell me what is the CSF? This is the one mnemonic, one concept, CSF. Then I told you, you have to identify this our 3 structures. Yes, MPM. So you have to tell me what is the MPM. Then I told you the another thing that you have to identify the V and then collapse tube in front of it O, and then there is the T. Tell me what is the VOT, vote जो नेता हमसे मांगते हैं. Okay, yes, so here is one query. Motion Sheikh is saying, sir, in hypoglossal injury last option was loss of general sensation from the entry to third. Yes, see here beta, hypoglossal nerve is pure motor, it will not supply the sensation, so leave that option, never think. Hypoglossal nerve is purely motor, it will supply only the muscles of the tongue, it will not supply the epithelium, so don't look over that option. Getting the point? Now hope you are having the clear concept. Yes, Mohsin beta, fine. Yes, Preeti, you are correct beta. C for corpus callosum. Okay, sir. S for septum pallidum and F for fornix. Remember, very soon this fornix will come in your FMG pattern. Any question had been asked already about over the corpus callosum. This is very important. Yes, there is the our midbrain. Yes, sir, there is the midbrain. Then it is the pons. Yes, question in FMG 2022 ask about the pons. They shown about the our MRI of the brain and they ask about it. And this is the our medulla. What is the VOT? Tell me what is the VOT? Yes. Okay, beta. Yes. V for vertebra. In front of the vertebra there is, yes, esophagus. Getting the point? And in front of the esophagus there is, yes, trachea. Everybody? Yes, Preeti, you are correct beta. Fine. And then I told you the concept, the upper part of the, yes, esophagus is known as the pharynx. So this is the pharynx. And upper part of the our trachea is known as the larynx. So this entire part is the larynx. And I told you that this is the very important muscle. Never forget, this is your genioglossus. Okay. So here is the our nasal cavity, oral cavity, and this is the larynx. So this part of our pharynx just behind the nasal cavity is nasopharynx. Then you can see this is the oropharynx and this will be the laryngopharynx. Okay. And I told you the various vertebral level also, that there will be the our first cervical vertebra C1, then you will see the C2, you will see the C3. Behind the nasopharynx first part there is the first cervical vertebra. Behind the second part of the our pharynx there will be the two cervical vertebra C2 and C3, and behind the our third part C3, C5 and C6, larynx C4, C5 and C6 will be there. फर्स्ट पार्ट के पीछे एक वर्टिब्रा, सेकंड पार्ट के पीछे दो वर्टिब्रा, थर्ड पार्ट के पीछे थ्री वर्टिब्रा. So easy concept, very important relation. So right now in your FMG 2022 one question had been asked. Yes, there was the question, they indicated the arrow between the C3 and the C4, that was the our upper border of the thyroid cartilage. Getting the point? And never excuse, no excuse with this C6. C6 is the our vertebra which is the narrowest part of the GIT. Yes, narrowest point of the GIT. Above to it there is the our pharynx, below to it there is the esophagus, above to it there is the larynx, below to it there is the trachea. So 5 MCQs over this C6 vertebral level during our class I taught you. What I taught you, this is the narrowest part of the GIT, one question. Yes, it is the cricopharyngeal junction, second question. Yes, at this part esophagus start, third question. At this C6 vertebra there is the ending of the pharynx, fourth question. Yes, at this level larynx is ending, fifth question. At this level trachea is starting, sixth question. And remember, it is the level where the common carotid artery is palpated against the carotid tubercle here. Okay, this is the NEET PG. Many questions are asked from here. And one last more thing I want to tell you, I told you here is the our T, below the T there is the H, and below to this H there is the word P. THP, yes, THP, thalamus. I told you. H for that was the hypothalamus, I told you. A P for pituitary gland, I told you. So this is the one quick review. At our detailed classes we discuss this all the things in detail, then immediately after we go for the radiology and the brain section. Getting the point? So you have to remember the different way. CSF you have to do, then MPM you have to do, then you have to remember this VOT, then you have to remember this THP. Complete. Okay, so this is the your quick revision. Fine. Now see here, this all the things we did already. Now we are looking for the neuro anatomy. Yes, various points we had seen. The FMG 2021, spinal cord ends at which level of in the newborn? Can you tell me the answer better? Yes, 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 yes. So one question they are asked from this all the topic. Yes, I told you one thing, that in adult spinal cord is ending at L1 L2 junction. Best answer is L1. So lumbar puncture is done at the L3 L4. But in children, yes, slightly lower, so you have to say about the L2 L3. So lumbar puncture is done at L4 L5. I told you the way. 1, yes, 1 2 3 4. Yes, here is a 2 3 4 5. So easy. Okay, so this is your pedia and anatomy integration. Yes, pedia, medicine, anat, integration. Lumbar puncture is important, and lumbar puncture was asked in your NEET PG 2021 also. Okay, so this is the one easy way. See here, yes, we had seen this answer. Answer is your in baby, the single best answer, L2 L3 both, but L3 is the best. See here, follow our notes, page number 19, where we discuss is all the things. In baby, the length of the spinal cord is approximately cross our vertebral canal, but then body grows, but nervous system, it does not show too much growth, so it remains short, and in adult it remains too much short. So in adult it is ending at which level? L1, but in children slightly lower level. Answer best is the L3. Okay, so you can go for this one. Next, can you see, identify the level. So this is the one tricky question. See here, we don't know, there are the different option, C1 C2 C3 C4 C5 C6. Exact wordings till now I had not got. These are the just proposed. But see here, can you see this one? Try to understand. Yes, I'm taking this one. Yes, can you see, this is the our design of the teeth. Take out any silly point. Yes sir, can you see, this is the mandible? Yes sir, we can identify this one. So this is the neck part. Can you observe? Yes sir, this is our definitely occipital bone. Correct beta? Fine. If this is the occipital bone, so just count simply. C1 cervical vertebra, this atlas, and then C2, then this is C3. So this will be your, yes, C4 C5 C6 C7. This is having the transverse process which is known as the vertebral prominence. Other question, that C1 is our atlas, C2 is our axis. So these are making the atlantoaxial joint, where there is our pivot joint. Again I want to recall you recently the question, superior and inferior radioulnar joint are also pivot joint. Here there is the rotatory movement, so no movement occurs here. So this was the earlier question, no movement. Okay, this noding, this rotatory movement occurs here. Fine. So clear cut, you can see this is the C3 and C4. And remember that at the C6, I told you right now, at the C6 there is our cricoid cartilage. At this level there is a cricopharyngeal junction. Fine. So remember, at this level there is the our upper border of the thyroid cartilage. You know, earlier there was the question that Adam's apple, can you see, this was the our 2018 or 19 question pattern. Thyroid cartilage is making the most prominent part. Right now, the upper border of the thyroid cartilage, it is located at which level? C3, C4. It has been asked. Okay, we are not aware, but you can count at least. Okay, sir. And you must know that cricoid cartilage, cricopharyngeal junction at the C6. So, with this knowledge, above the cricoid cartilage, there is a thyroid cartilage. You can guess the answer. So, on this basis, that you can mark junction of the C3, C4 at the level of the upper border of the thyroid cartilage. It will be the answer. Okay. So, these are the things. One more question from our neuroanat part. See here, identify the marked structure in image. So here you can see the medulla oblongata. Yes, I told you that this is the bulb. Medulla is dilated bulb-like structure. Yes, in the bulb you will see such kind of the appearance. Medulla is just truncated bulb-like structure. Okay, sir. There is one central elevation that is known as the pyramid and lateral elevation is known as olive. What I want to tell you, the central elevation is pyramid, lateral elevation is olive. Got the point? The tract, I told you about the tract. You can go at our YouTube channel where I told you that the tract, the bundle of axons which are coming through the pyramid known as the pyramidal tract. Yes, this tract comes and they crosses to the opposite side and then they reaches to the opposite side of the spinal cord. So this crossing is known as pyramidal decussation. Got the point? While the tract which are passing outside the pyramid, they will be known as the extra pyramidal tract. So these all the things we discussed at the our platform. Fine. So when you are cutting, then definitely the central elevation is our, yes, central elevation is pyramid and lateral to this pyramid, can you see the another elevation? Yes, lateral elevation is olive. So definitely this is pyramid and this is olive. Fine. So remember, this was our B. Getting the point, everybody? So these are our different things. We had not only discussed about our anatomy, we discussed with the integrated pattern about our different subjects. More things are there. Please stay connected. We will discuss more the questions and any kind of the doubt, any kind of the query, please drop the question. Yes, again I want to tell you, this is the integrated session. We cannot say we had completed all the things. We are also covering the structures which we can integrate with this one. Yes, you can comment if any question is left, you can comment, you can inform if any option is plus minus, you can comment if any words are changed, you can comment for the image, and please, whatever your knowledge, whatever your recall basis, provide us. We will make more bunch of the question in integrated pattern so you can learn more. So thank you very much. God bless you all. Now we are starting any more doubt discussion session. If you are having any doubt, please ask. Hope you all enjoyed the session. If you all enjoyed the session, just give me the clapping, thumbs up, your heart, fire, whatever the emojis you can use. Okay. Yes. Fine. Any doubt, you can ask. Yes, thank you, Preeti. Thank you. Yes, hello, Talim. Yes, how to join your classes? Better please contact the NLC center. You will get all the update at the NLC. We are doing our classes at the Delhi, at the Hyderabad, at the Calicut, at the Trivandrum, and many more centers are coming up. Okay, so contact at the our NLC center. And also you can get the different free videos at our NLC group at Dr. Shrikant Verma classes. Okay. Yes, better you can download the NLC app also you can download the Dr. Shrikant Verma classes app. Okay, thank you Talim, thank you for your love and respect. Yes, love from my side also to all you dear students. Yes, better 30 pages anatomy notes. I'm sharing. It was already shared. It was already shared. I'm sharing at the NLC group. Yes, it was already shared. I'm sharing to the our Dr. Shrikant Verma classes channel. I'm sharing to the NLC group. Whatever you want, you can go there. Yes, in this group, Ashish sir group, I'm sharing. You can find from that part. Okay, so I had shared. Yes, this is the integrated learning. Okay, beta. So focus over this. So any doubt, any kind of the thing? Yes, few lines for all of you. मुश्किलें इंसान को चलना सिखाती हैं, सपनों का पर्दा निगाहों से हटाती हैं। गिर गया गिरकर संभल ए एफएमजी स्टूडेंट, गिर गया गिरकर संभल ए एफएमजी, ठोकरे इंसान को चलना सिखाती हैं। तो नेवर 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 क्विट, लगे रहो बेटा। ओके, यस, आप एक दो नंबर से चूकते हो, रिमेंबर वो जो एक दो नंबर है वो आपको कुछ सिखाना चाहते हैं, वो आपको कुछ बताना चाहते हैं। इन डिफिकल्ट डेज में आप जो चीजें लर्न कर रहे हो, फ्यूचर में जब आप कोई प्रॉब्लम्स को फेस करोगे तो आप पाओगे अरे ऐसी चीजों से तो मैं पहले निपट चुका हूं, इससे खतरनाक चीजों से निपट चुका हूं, तो ये छोटा सा प्रॉब्लम मेरे लाइफ में क्या चेंज लाएगा। यस, यू विल बी वेरी वेरी स्ट्रांग, वेरी वेरी स्ट्रांग आफ्टर फेसिंग दिस ऑल द एग्जाम्स। वो एक दो नंबर ही आपको काफी चीजें सिखा कर जाएगा। तो every success story is having many failures and many unsuccess. Okay, so you will definitely break. सिर्फ एक चीज याद रखना, नेवर 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 क्विट। ओके, यस, ओके, सो थैंक यू Kehri, thank you Preeti. So we are ending the session. God bless you all the best. If any kind of the query, please contact us. Thank you, all the best. And remember, we had not completed many integration, we will do still now. Okay, all the best. God bless you all.